Democrats from the Committee on Natural Resources held a digital forum discussing the federal coronavirus response in U.S. territories, giving the CNMI an opportunity to request for more supplies and financial aid. Sally Limas reports.
Chairman Raul Grijalva and Vice Chairman Gregorio Kilili Sablan conducted a livecast roundtable discussion on how Congress can address serious problems with the Trump administration response to COVID-19 in the U.S. territories.
We are here virtually with panelists from all of the territories to hear about the virus response in American Samoa, the Commonwealth of Northern Mariana Islands, Guam, Puerto Rico, and U.S. Virgin Islands. More importantly, we want to receive the perspective about how Congress can help local governments adequately address this world pandemic. It's not just, and for the territories, it's even, I think they have a better understanding when we say world pandemic as opposed to just trying to keep it to the mainland here, the discussion. The territories face unique challenges based on geographic location, the unequal treatment under federal programs, and the dire financial situation.
Grijalva says one thing the virus has provided people is a perspective.
That as you go through and talk about recovery and relief, that there's a cumulative effect. When there has not been enough resources to a territory in this instance, as part of the history, suddenly you're drowned economically and in terms of health response with this very deadly virus. And so it becomes a cumulative effect of disparity at the beginning, and then you put disparity on top and you demand a response that is already taxing local communities and local governments.
Congressman Kilili Sablan says the CNMI continues to receive aid from Congress, FEMA, the U.S. Department of Health and Human Services, Department of Defense, U.S. Department of Interior, and other federal agencies. But the goal is to find out if more is needed. Sablan added his office is currently working on getting funds for education.
We're really having a difficult problem with Department of Education trying to get them to release the Education Stabilization Fund. We got notice yesterday. They withdrew that notice from public view today, and but we're trying everything. So it's way overdue for our schools.
Esther Muña, representing the CNMI, delivered the status of how Governor Ralph Torres and his task force has been responding to the threat of the coronavirus.
It has evaporated our livelihood, throwing our tourism-based economy into swift and acrimonious decline. The CNMI government is shut down and is projecting a $65 million deficit. The island schools closed, many public and private employees have been furloughed, skyrocketing unemployment, the retiree pensions cut 25%, rendering healthcare unaffordable for so many families. The CHCC's success thus far is a result of a Herculean effort requiring nearly 18,000 staff hours and over $7 million. Thanks to the governor, the support from the governor, and the COVID-19 task force, and the federal partnership of HHS and DoD through FEMA, and further supported by the CARES Act, we have been able to secure additional ventilators, PPE, laboratory equipment, testing reagents, establish a temporary 40-bed care site, and a longer-term alternate care site. We have received help to assess our surge staffing needs and develop a territorial action plan. We can now test for the coronavirus on island, an ability that felt far from our reach just 1 month ago.
Muña says the CNMI remains vigilant but is vulnerable to upheaval should a larger outbreak ever occur.
This assistance has been core to our success, but we do need continued federal assistance to put an end to this war. We at the CHCC must fulfill our regular obligations while balancing the coronavirus response and forging an ambiguous future to prepare for the worst. Our strengths and our weaknesses are brought into focus, while the disruption has sparked innovation and illuminated opportunities for improvement. We are in ample supply of vision and determination, but we need your help to establish a reliable, equitable supply chain for PPE and testing reagents. We need funding to keep our staff, including our robust contact tracing team at work. We need support for the long overdue expansion and modernization of our 35-year-old hospital. Along with our governor, his cabinet and task force, and Congressman Sablan, we are working hard to safely bring the rest of the cinema back to work. Help us get there.
Other representatives shared what their nation are also experiencing and the help they need to get back on track. Chair Grijalva says one thing they must work on is to define what recovery means to each territory.
What are we going to look like when we say we've recovered? What are going to be the systemic policies that are in place that change the relationship? How are we going to look at disparate treatment and equity in terms of resources and attention? Because I think that one of the things learned is the lack of preparedness. Some people might argue that in terms of the federal government to this pandemic. It's inability to react, and the lack of resources for public health, the lack of resources in terms of stockpile for medical equipment, the lack of a planning and strategy to deal with a pandemic and a virus of this nature. And so, this virus didn't care who it affected and how it affected, but it has transformed the way we look at things. And I think it applies to the territories as well. And I'm looking forward to what comprehensive steps we're going to take to make the recovery, the relationship different going forward.
Reporting for KSPN News, I'm Sally Limis.